Hey, and welcome back to All Things Dentistry, where we teach you about anything and everything under the dental umbrella. And today we want to touch on dental caries. But before we do that, don't forget to like, comment, and subscribe. So, what is dental caries and how do you get dental caries? So, typically, dental caries would be what people would call rotten teeth, or when your teeth are rotten, we just call it caries. So how does this happen? You need three things to be in place. One, your tooth must be there. Two, bacteria should be there. Three, some sort of sugar or carbohydrate that the bacteria feeds off. And then this all together happens over time. So typically what happens is your bacteria then feeds from, say, the food that you eat, to the carbs that you eat and the sugar that you eat. It gets energy and then it starts attacking your tooth. And over time, with a consistent attack, you start forming what we call caries. And you start seeing it typically when there's a hole in your tooth. So, to stop or prevent dental caries, what you don't want, or what you do want rather, is to not have the three combined in the same time. So you want to brush your teeth as commonly as you can. Why? Because the bacteria tends to be in the plaque that we have. So if you remove plaque often, you are decreasing bacteria often, and you're not allowing the three to be together at the same time. Also, if you watch the foods that you eat, we typically say less acidic food and less sugars. Why? Because if you don't have that, then bacteria don't have a whole lot to feed on to get the energy to attack your tooth. So if you could decrease those ones, then you're reducing the risk of dental caries in your mouth. So what happens when you do have caries? Now you've got this hole or this decay in your mouth. So what we do then, you've got several treatments that can happen. If it's still small and it's something that we can fix, then typically we go in, we clean, and we do what we call a restoration. So we remove all the carious part, or we clean out the cavity and we close it up with something that looks like your tooth typically, and then you well and good, and you can go back. But sometimes if the caries are just too big and they've gone too deep, and by deep we mean they've penetrated the different layers of your tooth. So they've gone from your enamel through your dentine, which is a layer below your enamel, and they've got all the way to the core, or close to the core of your tooth with your pulp, where your blood vessels are and your nerve area is. Then we can't restore that tooth anymore. So what we then do is we go right in and we have to clean your pulp chamber area, and that is called your root canal treatment. So we have to go in and denerve your tooth and clean that area up, and then obviously fill it from everywhere or within the tooth where we have typically cleaned. So that's your root canal, which is another option should your caries be way too deep. And then if you've passed that part, you can't do your root canal, maybe you can't then do your restoration, the other option is taking your tooth out. So we're not always keen on taking teeth out, but if we can't fill it, we can't restore it, then unfortunately we have to take it out. So those are some of the treatments that we do, but typically prevention is always better than cure. So look after yourself, don't let that caries form. And if you have a kid, let them visit the dentist often, so we can put maybe something we call fissure sealants. That's just to help prevent caries in certain teeth. It's something that you can do. And as an adult, I do advise see your dentist every 6 months or twice a year, so we can pick up these things earlier and maybe fix it if it's early, prevent it from happening, and then you can get the advice that you need personalized for you to prevent you from having dental caries. And that's it for today. Just some tips. Don't forget, tune in to All Things Dentistry. Like, comment, and subscribe. And we'll see you next time.